Causalytics is really about the fact that whether we like it or not, we judge patients. We judge patients by their diagnosis, we judge them by their medical history, we judge them by the information we gather in their H&P, and we judge them by their past. And I think one thing that healthcare providers might not think about is the fact that patients judge us too. We're very quick to label patients, and patients are very quick to label us. And we also have to worry about being labeled by regulatory agencies as well, as high prescribers or people who fall outside the norm, et cetera, et cetera. I really didn't understand how much precognitive thinking factors into medical decision making. I try to identify a number of different kinds of precognitive thinking that could potentially corrupt our assessment and treatment formulation planning. And I have to say, I'm probably guilty of the majority of them at some point in my life. But it's about us being able to really, as healthcare providers who want to do a good job, being able to recognize the fact that those things happen. And it could have negative consequences the other way too. It doesn't only mean that people judge patients, that healthcare providers judge patients as being at high risk. I've witnessed emergency department physicians saying it doesn't mean that healthcare providers are only erring on the side of judging people who are at increased risk. Sometimes people might judge people in the opposite direction. So I've heard emergency department physicians say, if somebody comes into my emergency department and they have cancer or sickle cell disease, they're getting whatever they want. That's not good either. That's prejudging them on the other side. So precognitive thinking is there for all of us. I think we make decisions actually before we think. We make decisions before we have all the information in front of us. And the talk about causalytics and the fact that in some situations patients might be actually blamed for the pain that they're suffering means that we probably make judgments on our history, on the patient's history, and not necessarily on the individual that's presenting in front of us.